Hi, this is Lindsay. I am doing an intravenous medication administration via IV. So the medication that I'm going to be administering today is Zofran. We are doing, the dose for this is 4 milligrams in 2 mils, so we will be doing the whole bottle. Before you give a medication to any patient, you want to make sure you have your 6 rights. So you make sure that you're giving this medication to the right patient, that it's the right medication for this patient, it's the right dose for this patient. You check it to make sure that it's not expired, make sure it's the correct route, which we already checked as IV, and that we document everything that we did, where it was at, that it's in the left arm, and it's the person, and that this isn't expired, and all of those things get documented. So we already have our IV in place. This is a 20 gauge with our pigtail. I have my flush ready. I'm going to open up my med. I'm going to take my syringe and my blunt. We are going to put air into it. Make sure that we get pressure so that we can fill our syringe up. We want to make sure that there's no bubbles or anything in there. Get as little air as possible.
And I will be going in at a 90-degree angle.
And it will be the whole vial, so it's going to take a little bit to
I'm going to aspirate back a little
get
bit
all of
to
it.
make sure we're in the correct spot.
Alright, so once we have 2 mils,
Ma'am, I'm now
and
entering
we
the
make sure we get all the bubbles out. We know our med is drawn up and good.
Now, once that is done,
Other thing we want to do, so when we give Zofran, the indications for Zofran are nausea and vomiting. Either they've already been nauseous and vomiting, or they're complaining of nausea and vomiting. Also to make sure your contraindications as well. So particularly wide QT waves, or if they have like a pre-existing arrhythmia, those would be things that we would want to make sure that they don't have before we give this medication.
once that is done,
Okay, so since this has been out for a little bit, we're going to want to clean it with an alcohol prep pad.
That's funny. How much did you flush?
Make sure it's all good and clean. And then we have this, so we are going to remove the cap. Oops, my bad.
How's that
Mhm.
easy trap? It's working.
Attach it. And then we'll slowly give this med. You don't want to give this med fast. By doing so, it can actually make the patient nauseous. So give it over several minutes. Make sure you put your sharps in the sharps container when you're done. And you'll slowly continue to give the med. I usually use my watch to measure the time as it goes by. This med can be administered, I think, every 10 to 15 minutes as needed for nausea. So we made sure the Luer lock is off. Once the med is in, we can disconnect this, and then we're going to want to flush it, just because there is a 1 or 2 mils that are still in this tube, which means they're not in the patient, so we want to make sure that we get all of the medication into the patient. And you can also flush this kind of slow too, you don't want to slam it. So with any drug, you always want to make sure you check their vital signs before you administer the drug, and then after you administer the drug. So you would reassess blood pressure, SpO2, heart rate. Again, in some people, if they do have heart issues, maybe this person doesn't know what they do, so it wouldn't be a bad idea to have a 12 lead going. And monitor for any allergic reactions or anything else that the patient might be telling you.
Sorry.
Alright. That is a intravenous medication administration of Zofran.